Hello and welcome to BAN's presentation on the Early Years Foundation Stage Safeguarding Reforms. So this is our briefing session on those changes to the safeguarding reforms that are going to be happening for the EYFS. We're going to guide you through those expected changes following on from last year's consultation, which are due to come into effect on September the 1st, 2025. Our goal in the session is to provide you with a summary of the potential changes collated by foundation years, covering the consultation responses, the expected updates to the early years foundation stage, and the actions you will need to take following these changes. Throughout this session, please note that any statements presented in blue writing highlight the changes, and anything with a strike through indicates content that is being removed from the current guidelines. So let's take you through the expected changes. Our first slide will be looking, or our first section, sorry, will be looking at safeguarding policies and procedures. A key change here relates to paragraph 3.4, which addresses the lead responsibility for safeguarding children. The language is changing from lead practitioner for safeguarding to designated safeguarding lead, or DSL. The action for you is that you'll need to update your policies to reflect this change in language from lead practitioner for safeguarding to designated safeguarding lead. The DSL is responsible for liaison with the local statutory children's services agencies and with the local safeguarding partners, the LSPs. In Bristol, that's the Keeping Bristol Safe Partnership. All practitioners must remain alert to any issues of concern in a child's life at home or elsewhere. So although the DSL is the lead, everyone must remain alert to issues of concern. This change in language brings the role in line with education and other children and young people's services, who already have the role of DSL in their guidance and regulations. The consistency in language across the multi-agency can help with ensuring the right people are sharing information in the right way, with no confusion about who is the responsible person for safeguarding. Moving on. Additionally, paragraph 3.6 outlines the essential inclusions for safeguarding policies. Your policies must include the action to be taken when there are safeguarding concerns about a child, the action to be taken in the event of an allegation being made against a member staff, a childminder or an assistant. Still there is how mobile phones, cameras and other electronic devices with imaging and sharing capabilities are used in the setting. But additionally now, you need to include procedures to follow to check the suitability of new recruits. You need to detail how safeguarding training is delivered and how practitioners are supported to put this in practice. So the action for you, if they're not already featured in your child protection policy, you need to add the procedures you need to follow to check the suitability of new recruits. And this might come from your safer recruitment policy and how safeguarding training is delivered and how staff are supported to put this into practice. Please note that safer recruitment processes are part of your safeguarding processes, and having these details in your safeguarding policy helps identify the links between these two processes and solidify that safer recruitment is part of your safeguarding responsibilities. Regarding supporting the staff team, think about what you already do to support your staff with ongoing safeguarding knowledge in between full refresher training. Is this part of your staff meetings? Is it inset days, any twilight sessions, Q&A sessions, any review of practice following an incident? Is it detailed on staff boards, in staff briefings or newsletters? Anything that you do to increase the safeguarding knowledge is now needed to be detailed in your policy. It's about having and implementing a system that works for you. Moving on to section 2, concerns about children's safety and welfare. This section brings important clarifications regarding child's absences and whistleblowing. These new expectations have been added to the EYFS. Providers and childminders must follow up absences in a timely manner. If a child is absent for a prolonged period or without notification, attempts must be made to contact parents and carers and emergency contacts. You must consider patterns and trends in a child's absence, their personal circumstances, and use professional judgment to decide if an absence is prolonged. Consideration must also be given to the child's vulnerability, the parent or carer's vulnerability, and their home life. Any concerns must be referred to local children's social care services and or a police welfare check requested. So the action for you. Try and quantify what you will consider to be a prolonged absence and when you will take action to contact parents and carers to ascertain children are safe. Also, ensure that you have someone in your setting with an allocated responsibility for checking absences and risk assessing those for indicators of harm. So you need to consider what your attendance or absence policy currently states. Are you giving due regard to absence trends being part of safeguarding or potential child protection issues? Do you have this reference in your safeguarding and child protection policy as a potential indicator of harm? How are you working with parents to stress the importance of attendance? And do you need to change the name of your policy from absence to attendance? But also say that in your setting, it may be the person who has to follow up the absence may be very different depending on what type of setting you are. Think about how it will work for your setting. There is also a new requirement for an attendance policy. Providers and childminders must have an attendance policy that they share with parents and carers. This policy must include expectations for reporting child absences and action that you will take if a child is absent without notification for a prolonged period. These actions may look like implementing the setting safeguarding procedures, following up with parents or carers, and contacting emergency contacts if parent carers are not contactable. The action for you, you'll need to update your attendance absence policy and update your parent and carer agreement to reflect that you now need to be informed of absences, whatever the reason. Ensure that reporting protocols are clearly stated in your policies and procedures. Additionally, consider adding a statement about absence to your safeguarding policy and how you may use this as an indicator of concern for a child or family. And again, think about how you're creating an environment at your setting so parents will come to you and will talk to you about their concerns that they may have about this, and how you will talk to them to make them understand that you need to apply this consistently with all parents and carers and families. Another vital reform relates to whistleblowing procedures. Providers and childminders must put appropriate whistleblowing procedures in place for staff to raise concerns about poor or unsafe practice in the setting's safeguarding provision. This must include when and how to report concerns and the process that will be followed. You must ensure that staff are aware of these procedures and be able to raise their concerns, knowing that they will be taken seriously. Where a staff member feels unable to raise an issue with their employer or feels that their genuine concerns are not being addressed, other channels are open to them. The NSPCC whistleblowing advice line is available. Staff can call on 0800 02 80285 or email help@nspcc.org.uk. Ofsted provides guidance on how to make complaints about childcare providers via their website. And there's general guidance on whistleblowing online. So the action for you: have a whistleblowing policy in place that details the routes to reporting and induct all staff in this policy. I think it's also, you need to think about how all staff can report concerns early and have clear routes so that they feel confident that any concern, however small, when they raise it, will be taken seriously and acted upon. It creates a safer working culture for everyone.
Okay, so now we're going to be looking at changes for suitable people within your provisional setting. So reforms here focus on strengthening safer recruitment practices, particularly concerning references. When employing assistants, providers and childminders must obtain a reference before employment. You should not accept open references, for instance, to whom it may concern, or rely on applicants to obtain their own references. References must be from the candidate's current employer, training provider, or education setting, and it must be completed by a senior person with appropriate authority to complete the reference and comment on that person's suitability for working with children. Do not accept references from a family member. If the applicant is not currently employed, obtain verification of their most recent relevant period of employment. References have to be returned to you before you can start a new recruit into a role. The references must meet the new standards, and it is likely that Ofsted will check these when they visit. So you need to think about how you ensure you are meeting these new expectations. Consider developing a reference checklist. We have a model policy or checklist here that you can ask to have a look at and use if needed. Continuing with reference changes, if the applicant is not currently working with children, secure a reference from the relevant employer from the last time they did work with children. If they have never worked with children, ensure a reference is from their current employer, training provider, or education setting. Ensure electronic references originate from a legitimate source. So contact referees to clarify content where information is vague or insufficient. And compare the information on the application form with that in the reference and take up any discrepancies with the candidate. You can do this at interview or after interview if that's when the references come in. Establish the reason for the candidate leaving their current or most recent post and ensure any concerns are resolved satisfactorily before employment. So when you're thinking about the actions you need to take, ensure all of these requirements are part of your safer recruitment procedures and explicitly stated within your written policy. Still looking at the changes regarding references, but now when providing those references for previous employees. References should be provided upon request in a timely manner. You should ensure the information confirms whether you are satisfied with the applicant's suitability to work with children. Crucially, you must provide the facts, not opinions, of any substantiated safeguarding concerns or allegations that meet the harm threshold. The harm test is explained in the disclosure and barring service guidance. You should not include information about concerns or allegations which are unsubstantiated, unfounded, false, or malicious. So the actions for you as providers are thinking about when asked for a reference, ensuring that you provide it as soon as possible and include relevant information on suitability. Ensure that whoever is responsible for writing references for ex-staff members or members of staff who are leaving really understands the harm test and what can and can't be included. And finally, for this section regarding recording for suitable people, group and school-based providers must record information about staff qualifications, identity checks, vetting processes and references. This is the new addition to the statement within the EYFS. This includes the criminal records check reference number, the date a check was obtained, and the details of who obtained it. So the action for you is to ensure that reference information is added to your single central record or whatever reporting record keeping process that you use within your setting. If you do not record this on your single central record, how will you show that these new checks have been completed? So you need to think about how you're evidencing these new expectations within your setting. We're now going to move briefly on to our next section, which is safeguarding training. So this is an area with significant changes. So providers must ensure that all practitioners are trained in line with criteria that are set out now in the new Annex C. The rest of the information regarding training has been moved to Annex C, and we will cover this later in the presentation on further slides. So the action for you is to ensure that all training practitioners and the training completed meets the requirements of the criteria in Annex C. And you also need to check your policies and processes to ensure that the former instructions regarding training are removed and updated to reflect these new changes within these reforms. There's also an emphasis on ongoing support and the designated safeguarding lead, the DSL, role within your setting. Providers must ensure that practitioners are supported and confident to implement the setting's safeguarding policy and procedures on an ongoing basis. Providers should read what to do if you're worried a child is being abused for practitioners. Providers should read what to do if you're worried a child is being abused, advice for practitioners. The designated safeguarding lead must provide support, advice and guidance to all practitioners on an ongoing basis and on any specific safeguarding issues as required. The DSL must attend a training course consistent with the criteria set out in Annex C. Crucially, this DSL training must be renewed every 2 years. Providers may consider whether any staff need to undertake annual refresher training during any 2-year period to help maintain basic skills and keep up to date with any changes to safeguarding procedures or as a result of any safeguarding concerns that occur in the setting. This is a change from the previous 3-year cycle. So an action for you is to ensure that all staff are inducted and understand the safeguarding policy and procedures on a continuous basis. Decide who will read and disseminate what to do if you're worried a child is being abused. Change the terminology from lead practitioner to DSL within all of your documents. Ensure the training completed by the DSL meets the requirements of the criteria in Annex C. And remember that staff must now renew safeguarding training every 2 years. And consider if you need to carry out annual refresher training within your setting as well. And within the context of these changes, it's helpful to consider what the word practitioners mean in your context. What will you do about supporting staff and their training needs? For example, support staff within your setting, such as administrators, cooks and cleaners, etc. Consider what the word provider means in your context. Who will need to read what to do if you're worried a child is being abused? Think about all of this within the context of your policies and your procedures going forward. So we're coming up on the next section, which is important updates to cover the training of paediatric first aid practitioners, staff ratios and food safety.
Paediatric first aid. The EYFS will now offer clarity regarding the training providers that can be used for PFA training, and the original content is being replaced with providers are responsible for identifying and selecting a competent training provider to deliver their paediatric first aid training. There is no hierarchy in relation to the range of training providers who offer paediatric first aid training. However, those who work under the following bodies are fully regulated. One is a member of a trade body with an approval and monitoring scheme, the voluntary aid societies and those who work under off-call awarding organisations. It may also be helpful to refer to the HSC's guidance about choosing a first aid training provider, which can be found at www.hssc.gov.uk/pub/GEIS3.htm. Here, the action to be taken is to ensure that your PFA training providers are competent and meet the necessary criteria for the 12-hour course. Regarding staff-to-child ratios, suitable students and long-term placements and volunteers aged 17 and over and staff working as apprentices in early education aged 16 and over may be included in the ratios at the level below their study. This is permissible if the provider is satisfied they are competent and responsible, and if they hold a valid and current PFA qualification. This is the update. So the action for you, if you're counting suitable students, volunteers and apprentices in ratios, ensure they hold a valid and current PFA qualification. Please note that staff who obtain qualifications after the 30th of June 2016 need to maintain a current PFA to be counted in the qualified ratio. Moving now to food and drink facilities. There are several key points related to safety, and there are a lot of changes here. While children are eating, there should always be a member of staff in the room with a valid paediatric first aid certificate. Before a child is admitted to the setting, the provider must obtain information about any special dietary requirements, preferences, food allergies and intolerances that the child has, and any special health requirements. This information must be shared by the provider with all staff involved in the preparing and handling of food. At each mealtime and snack time, providers must be clear about who is responsible for checking that the food being provided meets all the requirements for each child. So the action for you: ensure staff are deployed so there's always a PFA in the room while children are eating. Also ensure information on children's dietary requirements, preferences, allergies and intolerances is gathered before a child attends and is communicated to all staff. Leads should be identified for checking food. You will need to think about who will be responsible for ensuring all of these changes to food and drink are in place. More on food, and looking now at safe eating practices. Providers must have ongoing discussions with parents and carers, and where appropriate, health professionals, to develop allergy action plans for managing any known allergies and intolerances. This information must be kept up to date by the provider and shared with all staff. Providers may find it helpful to refer to the BSACI Allergy Action Plan. Providers must ensure that all staff are aware of the symptoms and treatments for allergies and anaphylaxis and the differences between allergies and intolerances that children can develop. Children can develop allergies at any time, especially during the introduction of solid foods, which is sometimes called complementary feeding or weaning. Providers may find it useful to refer to the NHS advice on food allergies at NHS, and the treatment of anaphylaxis NHS. So action for you: gather information at entry on children's allergies and intolerances, put a healthcare plan in place with medication as needed, and share with staff. Crucially, keep this information up to date. Ensure all staff know the signs of allergies and intolerances. Consider the introduction of solid foods in relation to allergies and intolerances. You will need to think about how you keep this information up to date, accessible but also confidential. Think about where the relevant information about children's dietary requirements is kept and accessed. Still carrying on with safer eating practices, and here we're looking at prevention of choking and to ensure general eating safety. Babies and young children should be seated safely in a high chair or an appropriately sized low chair while eating. Where possible, there should be a designated eating space where distractions are minimized. Children must always be in sight and hearing of a member of staff while eating. Choking can be completely silent, therefore it's important for providers to be alert to when a child may be starting to choke. Where possible, providers should sit facing children while they eat, so they can make children are eating in a way to prevent choking, and so they can prevent food sharing and be aware of any unexpected allergic reactions. When a child experiences a choking incident that requires intervention, providers should record details of where and how the child choked, and the parents and carers should be made aware. The records should be reviewed periodically to identify if there are trends or common features of incidents that could be addressed to reduce the risk of choking. Appropriate action should be taken to address any identified concerns. It's important to consider how this is built into any risk assessments that might need to be adapted. You will need to ensure robust planning and recording, including near misses re your health and safety protocols, so you can assess where adaptations might need to be made, e.g. cutting fruit into smaller pieces. It's worth reminding ourselves that this changes our response to children experiencing choking incidents and settings, and that children have died from these instances. So it's thinking about these changes as a further prevention to serious harm. Food and drink facilities nutritional guidance. Ofsted have also released new nutritional guidance that comes into effect on the 1st of September. This is for providers in England who are caring for children aged 0 to 5, and it's been published and it will come to effect in September 2025. Providers must have regard to this nutritional guidance. This means providers must take this guidance into account and should follow it unless there's a good reason not to. The guidance states that providing healthy, balanced, nutritious food ensures that all children get the right amount of nutrients and energy they need while they're growing rapidly. Well, it's especially important for children who may not have access to healthy food at home. This can help prevent children becoming overweight or obese. It's also to develop positive eating habits early on. Children's early experience of food can shape future eating habits. This can impact on children's long-term health, including maintaining healthy weight and good oral health. The early years are a crucial time to reduce health inequalities and set the foundations for a lifetime of good health. BAND will be updating our policies to ensure they align with this new guidance, and we can share these towards the summer with you. Again, most recommendations you will be doing your settings already, and it might be that you need to record evidence of this slightly differently so you can show how you're working within this guidance. Looking at the action to be taken, consider the food being provided for all ages of children attending your setting. Ensure it's in line with nutritional expectations. Develop your food and drink policies so they align with the guidance. And communicate it with parents and carers about the nutrition that needs to be provided from home, say in relation to packed lunches or snacks or drinks. Moving now to the next section, and we're looking at toilets and intimate hygiene. Providers must ensure an adequate number of toilets and hand basins are available, with separate facilities usually for adults. There must be suitable hygienic changing facilities for children in nappies. Crucially, the new information is that children's privacy is considered and balanced with safeguarding and support needs when changing nappies and toileting. And also there should be an adequate supply of clean bedding, towels, spare clothes and other necessary items. So the action for you: consider what staff are present and what can be seen when children are having their nappies changed or using the toilet. Ensure privacy is respected wherever possible while not compromising on safeguarding. Moving on to information about the child. There is a small but significant update regarding emergency contacts. Where possible, settings should hold more than 2 emergency contacts for each child. So the action for you is to make sure you have space on your registration forms for more than 2 emergency contacts and ensure these are completed. The aim of this is to support providers to be able to contact somebody in an emergency. If a parent doesn't have anyone as an emergency contact, that's a trigger to have a sensitive discussion around it. Think about who else is supporting them if there is no other family around. A school? A children's centre? How do you ensure a child is safeguarded when their parent carer is lacking the support structures for other families? And as I say, this needs to be a sensitive conversation. The final section of this presentation is looking at the new Annex C, where the criteria for safeguarding training has been moved. So looking at all staff, the criteria requires that training is designed for staff caring for children aged not to 5-year-olds and is appropriate to the age of the children that are being cared for. So if you care for older children, you need to cover those age groups. The safeguarding training for all practitioners and assistants must cover the following areas. What is meant by the term safeguarding? What are the main categories of abuse, harm and neglect? What are the factors, situations and actions that could lead and contribute to abuse, harm and neglect? And how do we work in ways that safeguard children from abuse, harm and neglect? How to identify signs of possible abuse, harm and neglect at the earliest opportunity. These may include significant changes in a child's behaviour, a decline in a children's general well-being, unexplained bruising marks or signs of possible abuse or neglect, concerning comments or behaviour from children. The training also needs to cover inappropriate behaviour from practitioners, childminders and assistants or household members or any other person working with the children. This could include inappropriate sexual comments, excessive one-to-one attention beyond what is required through their role, or inappropriate sharing of images. Any reason to suspect neglect or abuse outside the setting, for example, in the child's home, or the child might experience emotional or physical abuse because of witnessing domestic abuse or coercive control, or that a girl may be subjected to or is at risk of female genital mutilation. In addition, practitioners need to know how to respond, record and effectively refer concerns or allegations related to safeguarding in a timely and appropriate way. The setting safeguarding policy and procedures you need to know about. You need to know about legislation, national policies, codes of conduct and professional practice in relation to safeguarding. They need to know the roles and responsibilities of practitioners and other relevant professionals involved in safeguarding. Moving on to the training for designated safeguarding leads. The training for the DSL should take an account of any advice from the local safeguarding partners or local authority on the appropriate training courses. In addition to the areas set out in paragraph 2, the previous section, for all practitioners, training for the DSL must cover the elements listed below. They need to know how to build a safe organisational structure, how to ensure safe recruitment, how to develop and implement safeguarding policies and procedures, and if applicable, how to support and work with other practitioners or assistants to safeguard children. They need to know the local child protection procedures and how to liaise with local statutory children's service agencies and with their local safeguarding partners to safeguard children. You need to know how to refer and escalate concerns, including those described in paragraphs 3.8 and 3.9 of the EYFS, and those relate to recruitment and to sort of concerns about staff. You need to know how to manage and monitor allegations of abuse against other staff, and they also need to know how to ensure internet safety. So any course, training course that you send either all your staff or your DSLs for your settings must meet these criteria, otherwise you will not be meeting the new EYFS standard. We've come to the end of the briefing. Thanks for listening. If you have any more questions, do get in contact with your Childcare Advisor, or Michelle at BAND, or Evelyn at BAND. Jenny at BAND. As stated at the beginning, these slides can be shared with you on request, and an overview document written by the foundation years can be shared with you on request. A summary of the actions and potential policies and procedures to be updated can be shared with you on request, and you can contact us for our updated model policies and procedures.